numerous biases, not only as a chief administrative secretary, but all the way back to the beginning as a doctor. I graduated from med school in the year 2009, and soon enough, then it was easier to get posting. And so I was quickly posted as a medical intern in Machakos, level 5. One, because my mother thought I needed to learn my language, where I come from, and two, because it was a level 5 hospital then, so a lot of experience. And experience we did get. We were only 9 interns managing that big facility, and so we were always on the floor, always working. I remember some of the primary biases that I faced then would be attending to an old, Kamba grandfather man who actually declines to enter my consultation room because he has seen a young girl, and he's telling me in Kamba, where is the doctor? Can you go bring the doctor? And he refuses to seek care. That time he has, advanced BPH, he needs catheterization, he's in pain, he refuses. And it's a whole process. You can imagine, particularly then, with the workloads that were in outpatient centers. Sometimes, the patient would struggle through. By the time you try and find a male counterpart, you're 9 of you, covering the whole hospital. There's a lot of convincing that was required. Beyond that, again, more sort of examples of bias. I practiced for about 3 years, and then I was posted by the former DMS, Dr. Kimani. Those of us who know Dr. Kimani, I think you can't forget Dr. Kimani. And he posted me to the second hottest part of Kenya, Tharaka Nithi, Marimanti. I don't know if any of you have ever been to Marimanti. If you've not, then you don't have grit yet to work in a place where snakes hover around your office. And those are really disparate conditions to work in. We had one ambulance, which when it went off, you'd sit the next day because it's still on the road. Right now, I've been back to Marimanti. It's improved. Devolution is fantastic. I'm a proponent for devolution, much more accessible, but still a part of Kenya that requires a lot of support when it comes to health services. When I was posted there, I was posted as a DMOH. So then I joined a team of very experienced civil servants in the then DHMTs, the district health management teams. And we used to have all these many meetings, managing district affairs. And the first time I was taken by my predecessor to be introduced to the DC, the DC thought I was the assistant of the doctor who had come to introduce me. And so I sat outside for 2 hours, outside the DC's office, waiting. And later he said, huyo msichana siambie huyo mtu akuje, huyo daktari wake akuje, nataka kutoka. That's when the secretary says, I think she is the doctor. Kuna hii barua ako nayo anasema ni yeye. I'm not sure, And funny enough, and he's done very well, that DC, and we still meet. In fact, he's now the county commissioner, Mombasa region. He was laughing when I met him during the launch of UHC some 2-3 months ago with the president, and he was saying, please forgive me. He still remembers 11 years later the trauma he caused. But anyway, biases exist, and they exist primarily here because I'm a woman. I was a young girl then. I was 23 as a DMOH. And of course, dealing with, like I said, very experienced civil servants and trying to manage the affairs of a county when it comes to the health services. Fast forward to then finishing my master's and getting back to the Ministry of Health. When I graduated, I was probably, if I'm not wrong, the only health economist at the Ministry of Health. This was in 2016. And particularly, I mean a health economist who's trained in that specialty. And I remember sitting outside P.S. Moraguri's office, who is a friend of mine now, for almost 3 months, waiting to seek audience with him, to explain to him that I have this knowledge as a health economist, and I think we need to do 1, 2, 3 in NHIF, and we need to do 1, 2, 3 in health financing. And I was dismissed several times. Several times, many of you may not know, I spent 18 months unpaid in the Ministry of Health, hovering around those corridors, trying to jump into different surveys, trying to help different division heads to do their work. Dr. Maina, who I have to mention now as one of the women who held my hand very early on, Didn't know much about what we were doing as health economists, but she gave me a seat in her office and told me, sit there, make yourself useful. And interestingly, in that process of trying to work on the M&E plans of the ministry, I was able to encounter a Dr. Kimu. Again, if you're in that space, you may know who Dr. Kimu is. Very intelligent doctor, but not the most personable. He's my friend as well. He knows I tell him this. But he did also hold my hand. And in that process, I ended up being, I think, again, the youngest division head in the ministry at 27. I was the head of health financing. And that is when I met Nicodemus, who is in this room. And I was laughing when I saw you this morning. You can wave. We've worked together in NHIF with the former CEO then and the current CEO and all the strategy teams that have been there in NHIF in trying to put together what is now, I would say, the journey of UHC in Kenya. And again, biases existed in that process. I served as the health financing division head for some time. And as Afya Place is what you would call a political Game of Thrones. If you know what Afya House is, then you would know the kind of landscape we work in. I was quickly ousted for lacking a godfather in that space of a division head. But then, lo and behold, in times of strife, I ended up paying for a very expensive trip to Washington to go for the World Bank series. The World Bank holds events every April where health economists come across from all the different parts of the world, and we sit and we caucus and try to have intelligent discussions on health financing. I went to that event. I was essentially taskless. You can be in the ministry or in government structure and really not have a task that you're doing. So I was taskless for about 3 months, and I went to the spring meetings in Washington. Self-sponsored. I think I've been seeing politicians saying they're self-sponsoring their trips, so this was self-sponsored. And I was making a presentation on my thoughts on resource settings in different sectors. And in the crowd, did I not know, was the Cabinet Secretary for Health then, Madam Cecily Kariuki. And as I was making my presentation, I saw her and I started stuttering because I did not have travel clearance to be in Washington. I had done a little escape. Again, if you work in government, you know you need travel clearance for you to be able to leave this country and go to other places. And here I was with the minister. I'm not in her delegation. I've just introduced myself as working in the ministry. So of course she's wondering, who are you? And anyway, we went through the presentation. And so then it was my task after that presentation to find her and to, pass my apologies and to try and endear myself in that space. And in our discussions with her, I remember she was in the process of settling into the ministry, and she was looking at different strategic frameworks that are there. The health financing strategy was one of the things she was looking at. And the health financing strategy was my Bible. I knew it front, back, center, middle, left, right. And it's part of what I was doing when I was in the health financing division. And so I was able to walk her through some of those facets, and again, through her belief and through, I must say, her courage, because she was taking a chance on a little unknown individual in the ministry. She co-opted me into her office, and there, working in her office, I must say, one of the proudest things that we did is we had many, many meetings with His Excellency, the President, and we were able to fashion the UHC story. In my interactions there, I must say I met, again, many phenomenal women, and today I'm trying to sort of take you through my journey, and then, of course, what is going on in the sector in terms of the role that we all can play in lifting women up. And so I remember many, many incidences as we were trying to negotiate for resources for UHC. Nicodemus can tell you, our first budget was shot down. I think it was 350 billion, I'll never forget. That was the ask we had of the president, and we were so brave to walk in and say, give us 350 billion and you will have UHC. And he laughed, and rightly so, because, when you look back, there was an element of, should I say, wishful thinking in terms of the fiscal space that the country has. And during subsequent meetings with His Excellency and the team in the OP, We were able to come to a moderated budget, and the program was initiated. Again, through that process, I met fantastic people who are guiding and shepherding processes within the country. I must mention Madam Ruth Kagia. She's the Deputy Chief of Staff, another woman who again pulled me up. And I do remember meetings where if this is a boardroom, there's a boardroom in State House. There are many, but there's one that's really long and narrow. And I was Mutuamkono. So I was always the one with the laptop at the corner. And if you're Mutuamkono, you're at the corner there, near the pots with the flowers, and the minister and everyone else is here, and all the big people are near the president. And I was moving slides, and we were really nervous because it was the last meeting, it's the last chance we had to sell this UHC agenda. And, everyone was nervous. And, if you remember at that time, there's a lot of, should I say, political pressure to ensure that the UHC Big Four agenda had kicked off. And so we're going through the presentation, and there was one slide, and, copy-paste is never a good thing. There's a slide that had been copy-pasted from past slides, and so it didn't quite make sense, and the minister was presenting. And there was silence, so, because it didn't make sense. She also stuttered, it didn't make sense, and the president paused, and everyone was quiet. Nobody knew what to say next. And then there was a pause. Everyone was very nervous in the room. And His Excellency became very irritated, and he's like, what's going on here? I think, Muganda, you know what it means when he starts hitting the table. And I remember sort of going like, I'm trying to urge on the presenter to make the next point. Come on, it's 4 times what, so that you can get the number of households times 6,000 times. And then he goes like, you young girl, nodding your head at the corner. And then I started going like, nope. You cannot talk, you cannot speak when the minister is there. You cannot speak when the bosses are there. And I'm sort of shaking my head, don't make me speak. But this is the president who's telling you, say something. And I did. And that is the story of how I ended up where I am now as CAS. It's a story that many people don't know back then. And the UHC programs that you see today running, all the efforts that you see today running, of course, are running because of a team, but I'm proud to say I think my name would be indelible in that story in this country. When we look at biases, I've come to learn, particularly reflecting on now almost 2 years of working at senior level management in the ministry, is that our biases can be internal within, inherent in ourselves, but also in our environment externally.